And I remember that first day I met him, and
I got there just before Dr. Vogelman did.
I just remember going to like 10 or 12 interviews, and they were all about the same, which was like a PowerPoint presentation in the beginning, going through all the dry logistics of the program.
Waltzed into the room with his kind of zen-like bearded demeanor, and
I wasn't prepared for, but he spoke so eloquently and sort of
talks about internal reflection versus external reflection.
Saying this might not be the best program for you, or it might be the perfect program for you, but this is kind of the things that I've learned over the years.
That was really, really, really refreshing to me.
I don't think anybody else really had sort of spoken to me in terms of what I wanted to get out of a program, and so I sort of immediately felt like I could see myself here, you know, like it felt like home.
And I remember in that moment saying to myself, oh my goodness, I'm a New Yorker, but I'm gonna live in Wisconsin.
that was my first impression of Dr. Vogelman.
When I knew I was going to be on with him, that I would have to double the amount of time that I would need to spend on the patient, because there were always questions that Bennett would ask that I wouldn't know the answer to. And my goal was to present a case one time where he couldn't find a question that I wouldn't have the answer to. So I would really, if I spent an hour with a patient when he was on, I would spend 2 to get around that very concern. But I think the thing that first struck me was how genuine he was. You know, the things that he said about the program and about his involvement. You could tell that he really felt it, and that's what I think spoke to us the most.
Trust but verify is the most important thing that Dr. Vogelman has taught me, and he teaches you not to take anything you read about a patient or hear about a patient at face value, and to really go explore these things for yourself.
Is curiosity, sort of this constant push to learn more, to know more, to understand your patients more, and to really be curious about them. Because the moment you sort of stop being curious about their lives and their symptoms and what's really going on with them is the moment you stop learning and you stop taking the best care of them. And
you know, the other stuff you can get from books. You don't need to know the nitty-gritty of how to treat XYZ, but how to arrive at the diagnosis in a way that is elegant and natural and effortless. That's what I wanted to learn, and that's what I felt he gave us.
Making a workforce of physicians, all of the physicians that come through this residency, but they're trained to be so much more than just a clinician. They're trained to be the doctor that everyone would want, the doctor that you can come into a room and sit and tell them your problems, and they're gonna be patient and listen to you and never make you feel uncomfortable or make you feel like there's this hierarchy. I feel like he makes this so much better at our jobs, way beyond just like knowledge and training.
That he gave us the possibility of seeing that the world was full of opportunity in medicine. And he never closed any doors without opening 5 more. I was a little floored, I have to admit. I didn't think that a program director would take that level of interest in a trainee. But he did, and not just then, but you know, subsequently going forward too.
with the longevity that he kind of provides here, I really take comfort, and now as a chief can definitely say that things only really change because it's in the best interest of the residents. And I think we wouldn't have that if it wasn't for him sort of in this position and really being able to fight and speak up for kind of what's best for the residents.
Bennett's ability to not burn out, to keep reinventing himself, to keep enjoying what he did, to keep being engaged with the residents in such a way that was beneficial to him as well as them, led our residency to be amazing in terms of being so steady, so ongoing in a way in which it wasn't dramatically changing every few years.
So I'm not really sure what has allowed him to still have high energy and enthusiasm after 25 years, but certainly when I talk with people at other programs, everyone knows Bennett Vogelman.
Well, I think he's matured into a wonderful program director and a wonderful teacher. And I think his residents look up to him for that.
All of his residents have tremendous respect for him, and we really do see how much he advocates for us and how hard he works to make sure that we have the best residency experience that we can. And all the work he does not go unnoticed.
Helping me to find out who I was and what I really stood for, and just helping me to bloom through like 2nd and 3rd year. I don't know if I would be the person or the doctor that I am today without him. And as much as it was like tough to move away from my family, New York and everything I was accustomed to, I wouldn't do it differently. because of the person that I've become, which is a lot to do with Dr. Vogelman's interest in making sure that I become the best physician. I don't think I would be able to be this person without him, and to be this confident and like comfortable in my own skin.